Question 1. A nurse is caring for a patient undergoing internal radiation brachytherapy for cervical cancer. Which action is the priority? A. Allowing the patient's family to stay in the room for emotional support. B. Encouraging the patient to ambulate to prevent complications. C. Limiting time spent near the patient to reduce radiation exposure. D. Assigning a pregnant nurse to care for the patient. Answer: C. Limiting time spent near the patient to reduce radiation exposure. Question 2. Which task is appropriate for the nurse to delegate to an experienced UAP when caring for a patient receiving internal brachytherapy? A. Monitoring the patient for signs of radiation exposure. B. Assisting the patient with meal setup from outside the room. C. Providing perineal care while the radiation device is in place. D. Disposing of the radiation implant after therapy. Answer: B. Assisting the patient with meal setup from outside the room. Question 3. A nurse enters the room and finds the brachytherapy implant dislodged on the bed. What is the nurse's immediate action? A. Call the radiation oncologist immediately. B. Pick up the device with gloved hands and flush it down the toilet. C. Use long-handled forceps to place the implant in a lead container. D. Instruct the patient to reinsert the implant. Answer: C. Use long-handled forceps to place the implant in a lead container. Question 4. What is the best method to ensure staff safety when caring for patients with internal radiation therapy? A. Maintain a distance of 1 foot at all times. B. Wear a lead apron during all patient interactions. C. Rotate staff to limit individual radiation exposure time. D. Use a dosimeter only if symptoms of exposure occur. Answer: C. Rotate staff to limit individual radiation exposure time. Question 5. A patient undergoing brachytherapy reports feeling anxious and isolated. What is the nurse's most appropriate response? A. Stay in the room for extended periods to comfort the patient. B. Suggest family members visit at any time. C. Provide emotional support using the intercom system and short visits. D. Reduce radiation precautions to improve patient comfort. Answer: C. Provide emotional support using the intercom system and short visits. Question 6. What instruction should the nurse give to a patient with an internal radiation implant? A. Ambulate frequently to promote circulation. B. Avoid lying still to reduce complications. C. Remain in bed with limited movement to prevent displacement. D. Sit in a chair for meals. Answer: C. Remain in bed with limited movement to prevent displacement. Question 7. Which staff member is appropriate to assign to a patient receiving internal brachytherapy? A. A pregnant LPN. B. A new graduate RN. C. A float nurse unfamiliar with radiation precautions. D. An experienced oncology RN. Answer: D. An experienced oncology RN. Question 8. Which action by a nurse requires immediate intervention during internal radiation therapy care? A. Wearing a lead apron during care. B. Using a dosimeter badge. C. Disposing of linens in standard waste bins. D. Spending 45 minutes inside the patient's room. Answer: D. Spending 45 minutes inside the patient's room. Question 9. A patient asks why they cannot have visitors during internal brachytherapy. What is the best explanation by the nurse? A. Visitors are not allowed because of infection risk. B. Family members might interfere with your treatment. C. Radiation exposure can harm others, especially children and pregnant individuals. D. The doctor ordered isolation for your safety. Answer: C. Radiation exposure can harm others, especially children and pregnant individuals. Question 10. Which action should the charge nurse take when a UAP is about to enter a room of a patient receiving internal radiation? A. Allow the UAP to perform routine care unsupervised. B. Reassign the UAP to a different patient. C. Instruct the UAP to monitor the patient's vital signs. D. Provide lead shielding for the UAP. Answer: B. Reassign the UAP to a different patient. Question 11. During brachytherapy, the nurse observes a visitor sitting next to the patient's bed. What is the nurse's best response? A. Close the door and let them continue the visit. B. Ask the visitor to leave the room immediately. C. Instruct the visitor to wear a gown and mask. D. Allow the visit for emotional support. Answer: B. Ask the visitor to leave the room immediately. Question 12. What is the correct placement for a lead container in a brachytherapy patient's room? A. Inside the patient's bedside drawer. B. Outside the room for safety. C. On the floor near the doorway. D. At the bedside in case of device dislodgement. Answer: D. At the bedside in case of device dislodgement. Question 13. A nurse caring for a patient with cervical brachytherapy should prioritize which assessment? A. Bowel sounds. B. Position of the radiation source. C. Skin turgor. D. Peripheral pulses. Answer: B. Position of the radiation source. Question 14. What is the nurse's role in handling a dislodged brachytherapy implant? A. Secure the area, use forceps, and notify radiation safety. B. Ask another nurse to dispose of the implant. C. Flush the implant in the toilet immediately. D. Ignore the implant unless the patient is symptomatic. Answer: A. Secure the area, use forceps, and notify radiation safety. Question 15. What should the nurse do before entering the room of a patient undergoing internal brachytherapy? A. Remove all metal objects. B. Notify radiology. C. Wear a lead apron and dosimeter badge. D. Administer a sedative to the patient. Answer: C. Wear a lead apron and dosimeter badge. Question 16. What should a nurse do if a patient receiving brachytherapy needs urgent toileting assistance? A. Ask the patient to ambulate quickly. B. Call radiation therapy to remove the implant. C. Assist the patient while minimizing time in the room. D. Delay care until shift change. Answer: C. Assist the patient while minimizing time in the room. Question 17. Which behavior from a staff member indicates a need for further teaching regarding internal radiation precautions? A. Wearing a lead apron. B. Standing 6 feet away from the patient when possible. C. Using the same dosimeter badge for 2 shifts. D. Limiting care to 30 minutes per shift. Answer: C. Using the same dosimeter badge for 2 shifts. Question 18. The nurse is teaching new staff about internal brachytherapy. Which point should be emphasized most regarding patient care? A. Use gloves at all times. B. Limit close contact time and increase distance. C. Instruct patients to remain active. D. Assign pregnant staff for compassionate care. Answer: B. Limit close contact time and increase distance. Question 19. What is the best way to monitor cumulative radiation exposure for nursing staff? A. Annual health checkups. B. Wearing gloves and gowns. C. Using a personal dosimeter badge consistently. D. Attending radiation safety lectures. Answer: C. Using a personal dosimeter badge consistently. Question 20. A patient undergoing brachytherapy is disoriented and attempts to leave the bed. What is the nurse's first action? A. Restrain the patient immediately. B. Notify the physician to discontinue therapy. C. Stay with the patient and call for assistance. D. Document the incident without action. Answer: C. Stay with the patient and call for assistance. Question 21. Which is the most important reason to restrict pregnant visitors from entering a brachytherapy patient's room? A. They might trip over equipment. B. Their emotional distress may affect the patient. C. Radiation exposure poses a teratogenic risk. D. The patient may feel embarrassed. Answer: C. Radiation exposure poses a teratogenic risk. Question 22. A nurse notices that the radiation in use sign is not posted outside a brachytherapy patient's room. What is the best action? A. Ignore it if patient care is complete. B. Immediately place the warning sign. C. Wait until the safety officer is notified. D. Document the missing sign and proceed. Answer: B. Immediately place the warning sign. Question 23. The nurse is planning care for a patient undergoing vaginal brachytherapy. What is the best room assignment? A. Semi-private room with another oncology patient. B. Isolation room with shared bathroom. C. Private room with a private bathroom. D. Pediatric unit room for close monitoring. Answer: C. Private room with a private bathroom. Question 24. A patient receiving brachytherapy has constipation. What is the nurse's priority action? A. Encourage a high-fiber diet. B. Administer a laxative to prevent implant displacement. C. Apply an abdominal binder. D. Notify the primary provider to remove the device. Answer: B. Administer a laxative to prevent implant displacement. Question 25. What is a key element of staff education when preparing for brachytherapy treatment? A. Procedures for implant insertion. B. Protocol for lead shielding and exposure limits. C. Proper insertion technique for catheters. D. Managing patients' chemotherapy schedule. Answer: B. Protocol for lead shielding and exposure limits. Question 26. Which type of nurse should be excluded from routine care of a patient with an internal radiation implant? A. Male nurse. B. Nurse with a pacemaker. C. Licensed practical nurse, LPN. D. Nurse trained in oncology. Answer: B. Nurse with a pacemaker. Question 27. A patient asks how long the implant will stay inside the body. What is the appropriate response for low-dose brachytherapy? A. It is permanent and stays in the tissue. B. You will carry the implant for up to a year. C. It usually remains in place for a few days. D. The implant is removed after 1 hour. Answer: C. It usually remains in place for a few days. Question 28. After a brachytherapy procedure, which symptom reported by the patient requires immediate evaluation? A. Mild fatigue. B. Urinary urgency. C. Chest pain and dizziness. D. Nausea during meals. Answer: C. Chest pain and dizziness. Question 29. What is the rationale for placing the brachytherapy patient on bed rest? A. To allow time for radiation absorption. B. To prevent the implant from overheating. C. To reduce the risk of implant displacement. D. To avoid skin breakdown. Answer: C. To reduce the risk of implant displacement. Question 30. Which sign indicates that the nurse should notify the radiation safety officer immediately? A. Radiation badge reading increases. B. Patient complains of thirst. C. Implant is not visible but suspected to be displaced. D. Nurse has nausea during care. Answer: C. Implant is not visible but suspected to be displaced. Question 31. What is a safe practice when handling linens from a brachytherapy patient? A. Place linens in biohazard bags. B. Double bag linens before disposal. C. Handle linens with forceps only. D. Use standard precautions and avoid shaking. Answer: D. Use standard precautions and avoid shaking. Question 32. Which patient education point is most important post-brachytherapy discharge? A. Avoid sleeping on your back. B. Avoid close contact with pregnant women or children for several weeks. C. Do not lift anything over 5 pounds. D. Limit sun exposure to protect the site. Answer: B. Avoid close contact with pregnant women or children for several weeks. Question 33. When entering the brachytherapy room, which action best limits the nurse's radiation exposure? A. Wearing gloves and gown. B. Sitting during assessments. C. Using time, distance, and shielding principles. D. Standing directly in front of the patient. Answer: C. Using time, distance, and shielding principles. Question 34. A family member asks why only brief visits are allowed. What is the best nurse response? A. It helps the patient rest more. B. Visitors may become upset by medical equipment. C. Radiation exposure must be minimized for everyone's safety. D. The physician wants to limit emotional stress. Answer: C. Radiation exposure must be minimized for everyone's safety. Question 35. Which precaution should the nurse implement while turning a patient receiving brachytherapy? A. Use full body lift to avoid pressure. B. Turn the patient quickly and leave the room. C. Keep the body aligned to prevent implant displacement. D. Ask 2 UAPs to assist with repositioning. Answer: C. Keep the body aligned to prevent implant displacement. Question 36. When is the best time to measure exposure on a nurse's dosimeter badge? A. Weekly at home. B. At shift end before leaving the facility. C. Before entering the radiation room. D. Continuously during clinical exposure. Answer: D. Continuously during clinical exposure. Question 37. A brachytherapy patient's lead container is missing. What is the nurse's priority action? A. Replace it with a metal box. B. Continue patient care and inform the next shift. C. Notify radiation safety and avoid patient contact. D. Move the patient to a different room. Answer: C. Notify radiation safety and avoid patient contact. Question 38. Which patient statement indicates the need for further teaching about brachytherapy? A. I understand I need to stay in bed. B. I can go home after the implant is inserted. C. I should limit contact with others for safety. D. Visitors must stay behind the shield. Answer: B. I can go home after the implant is inserted. Question 39. Which of the following is most important when evaluating staff compliance with safety protocols in brachytherapy? A. Proper charting technique. B. Hand hygiene performance. C. Time log spent in patient room. D. Emotional support given to patients. Answer: C. Time log spent in patient room. Question 40. Which staff behavior best demonstrates safe delegation in brachytherapy care? A. RN delegates perineal inspection to UAP. B. RN asks LPN to administer chemotherapy. C. RN performs implant position checks. D. RN allows family to assist with hygiene. Answer: C. RN performs implant position checks. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!